Deborah Tomlin
You look wonderful. You feeling better today?
A lot better.
has been a nurse for 12 years.
Every day is a different day when we come on. Some days it can be that we, peaceful or quiet or calm down, and as soon as we say that, then something happens. So every day's a different day.
She takes care of patients,
I'm going to listen to your lungs and everything, okay?
but is also a clinical manager.
I'm going to be taking care of a couple of med-surg patients. They have had either surgery or they're coming in to have surgery. You're going to be good to go. We're providing post-operative care. Your glasses were already sitting out, weren't they, sir? As well as getting them up, having them move around, encouraging them, teaching them, things like that, and preparing for their discharge.
Everyone works as a team and respected in how they contribute to each patient's care.
She still says she has a lot of pain. IV sites, we're going through them pretty quickly. Anybody can be taught to be a great nurse, but you got to start with the foundation, and that's the right attitude. What else can I do for you while I'm in here? Is there anything else, any personal needs or anything you need? It is a typical morning. Let's go in there and draw that up at the bedside. The paperwork's normal. A physician walks in, kind of throws a wrench in your operation, but that's kind of why the team is so good.
The best part of her day?
So this is the Zofran. Then I've got a little saline. I'm going to kind of follow behind it to make sure that I keep your little tube flushed.
Interacting with her patients.
Little stick, okay? All right. Now we're going to get you back to bed. And get you comfortable so you can eat your lunch. All right? Once you break the barrier and kind of have and develop that relationship with that patient and that trust, then they kind of open up and let you know what's going on or if there's a concern they have. Now let's put a couple of them across here so when you stand up, your dressing doesn't fall out. Every day we know that we're going to discharge a lot and get a lot in, and that's why I think the teamwork's so great, because when I was in another room, another nurse was giving pain meds for me.
I just give 41 something for pain. I give when he got the chart.
Okay.
Nurses are also very loyal to ETMC.
I think we've, Land, how long have you been here now?
41 years.
41 years. The same company, right?
Yes.
And that's dedication. So it must be a good place to work, because you wouldn't be here for 41 years if it wasn't, right? One of the things I like about ETMC is we have a residency program, and we also have a critical care nurse program. Both allow nurses to come in, and we continue the education even though they have graduated from the nursing program, so that when they're ready to come off orientation, they feel comfortable taking care of the patient, as well as make sure that they're growing before we ask them to charge or work another unit. Today I was actually able to spend a little time with the patient and interact with them. Just hit the call button, I'll help you come and get back to bed, okay? But at the end of the day, when you get through and you know you've touched somebody's life or you've made a difference or you're watching somebody get well that's going to go home, it's the reason you come do it every day. Let's try a protein shake, and I'll get that made up for them, and dietary, and bring it with us lunch.
You might like that, yeah.
Today everybody had a good outcome, got patients cared for, changed dressings, and felt like when I was giving a report on to my next nurse that I wasn't leaving her a mess. So today was a great day, and I would take days like this any day. I personally wouldn't work anywhere else. I think my blood runs teal. All right, see you tomorrow. Thanks.